Hello everyone, it's me Tito again, and today I would like to give you lectures on systemic pathology 2. Subject of this lecture now is about pathology of bone and joint. For the first time, I would like also to give you a brief introductions on this subject, on this systemic pathology. The subject actually has a 3 credits, okay, 2 credits for lectures and 1 credits for practice. The coordinator is Dr. Dewi Ratih, and in total we have 9 lecturers that will give you some explanations on various subjects in pathology. So these lectures actually describe the causative, macroscopic, and microscopic morphology, including with the pathogenesis in many organ systems, in particular organ systems which are not discussed in systemic pathology 1. Yeah, and then in systemic pathology 2, you also will have a practical sessions. In these practical sessions, you will learn a microscopic changes in histopathological slides from all organ systems, including organ system that you already learned in systemic pathology 1. The learning outcome of the lecture is you are able to describe the tissue changes due to various disease, whether it's infectious and non-infectious diseases. And also in practice that you are able to describe and identify microscopic changes in many organ systems. So the final grade are the cumulative points will be obtained from 70% of marks in the mid and final term exams, and then 30% from practice. From that 30% of practice, 20% is from a practice exams and 10% from the practice reports. Okay, and then practice exams will be done twice in this semesters. First is at the week 7 after the 6th practice, and then at the weeks 13. Okay, and then the final grade is ranged from A to E, and it will be made based on average class grade. So for practice, you must have a 100% attendance, and then if you cannot join one of the exams, you should come to the Secretariat of Pathology, and you should also bring a permission letter which is already signed by the Vice Dean on Academic Affairs. Okay, and then for that makeup exams, you should do the exams 2 weeks after the true exams. Why? Because if you pass that 2 weeks periods, unfortunately, we will give you 0 on the marks. Okay. And then for the rules and regulation in lecture and practice, you must have a 100% attendance, just like I said before. And then you have to make reports, and those reports should be submitted to the lecturer after each practice. And I think for this online class, you will have to submit your reports online. Okay, we will provide the link for you. So this is a book that used for this subject. Okay, we use this veterinary pathology book with you can see we veterinary pathology books from the Jones, Hunt, and King, And then this is our main textbook. This is Pathologic Basis of Veterinary Disease. I think you can read and you can get this book in the LSE, okay, if possible, but maybe difficult for now. But I think some of the online source also provide this kind of books. And then this is also a atlas on veterinary pathology. We will give you some lectures based on the lesions that described here. And then this is illustrated veterinary pathology. This book I think can be obtained in some online sources. You can look for it by yourself. Okay, and then for practice, we also provide this atlas of histopathology. For this atlas of histopathology, if you like to order it, you can ask the Secretariat of Pathology to Miss Kiki, and the price is 75,000 rupiah. Okay, now we will discuss about our lectures. It's about the bone and joint pathology. Okay, you know what is bone, right? Bone is a compact structures, compact and hardened structures. If we look closely, if we look in more detail, bones regulates by many cells. The main cells that regulate the bone structures are first is osteoblasts, then osteocytes, osteoclasts. That's the three kinds of cells, the main cells that regulates the bone functions. Okay, and then the hormones that regulate bones formations is one is PTH or parathyroid hormones, and the other is calcitonins. And then the bone matrix. The bone matrix is part of bones that makes the bone hard. Bone matrix composed from collagen type 1. And then the formation of this bone matrix also regulate by some enzymes or hormones, and those enzymes and hormones and also main cells are using some of the minerals. These minerals usually used for enzyme activators or also as a main substance to make the bone matrix, for example calcium and phosphor. Okay, so this is a diagrams. I think this is the not diagram, sorry, this is the illustrations of osteoblast, illustrations of osteoclast. Okay, osteoblasts and osteoclasts, they are working together so, to make bones. Okay, however, they have a quite contrast functions. Okay, before I discuss about the functions, I would like to give you some brief explanations on the origin of this osteoblasts and osteoclasts. Osteoblasts originated from the bone marrow mesenchymal stem cells. These mesenchymal stem cells will be differentiated into osteoblasts. Osteoblast has a quite large cytoplasms. The cytoplasms contain a lot of organelles, and these osteoblasts will differentiate later into mature osteoblasts that we call as osteocyte. And then how about this osteoclast? Osteoclasts originated from the hematopoietic stem cells, and these hematopoietic stem cells will differentiate into macrophages, and then these macrophages will be proliferate and then differentiates in bone into young osteoclasts or pre-osteoclasts, that this pre-osteoclasts will be differentiate into mature osteoclasts. This mature osteoclasts will have more nuclei and also have more organelles. Okay. Now we will talk about osteoblasts. So this osteoblast activated by paracrine and endocrine stimuli. Paracrine means the osteoblasts will be activated by the secretions from other cells around the osteoblast. That means paracrine. And endocrine will be stimulated by hormones. In particular, two kinds of hormones, parathyroid hormones and calcitonin. The main functions of osteoblast is to produce bone matrix, or we call it osteoid, and also bone mineralizations. There are two types of osteoblasts based on its morphology. First is activated form. Okay, activated form has a cuboid or plump structures, plump morphology, and it has a basophilic cytoplasms. Okay, it is cuboid because it has quite large cytoplasms. Why the cytoplasms large? Because it contains many rough endoplasmic reticulums. So it's really active on synthesis of proteins. And then this activated form will be found mainly in young animals. So animals before puberty will have a lot of this activated form of osteoblasts. However, older animals, okay, or older individuals will have passive form of osteoblasts. Usually for passive form of osteoblast is the shape is flat with thin cytoplasms because it has less organelles. And then osteoblasts work together with osteoclasts, okay, to form a alkaline phosphatase abundant osteocytes projections. Okay, because this alkaline phosphatase is kind of enzymes that also activate osteoblasts and osteoclasts. So how about osteocytes? Osteocytes actually is a kind of cells that actually also form or differentiate from a osteoblast. In short words, osteocyte is a mature osteoblast. Okay, but the locations of osteocytes is different. Okay, I will explain about it later to you in the following slides. And then between osteoblasts and osteocytes are connected with small tunnel, we call it canaliculi. And the functions is how to fill the main function of osteocytes is how to fill a fluid in the bone structures. So and also it has also functions on giving the nutritions to the bone matrix or osteoid. However, its function in bone formation is minimum, although it helps bone hardening. Okay, osteocytes helps bone hardening because it also helps to produce and activates the collagen type 1. And then extreme stress, in particular stress that leads to calcium metabolisms or leads to decreased calcium depositions in bones will initiate what we call as osteocytic osteolysis because calciums calciums also activate the osteocytes. Without calcium, osteocytes cannot do their main functions to give or to initiate or to facilitate the nutrition transport into the bone matrix. Okay, this is the histology of bones. This is what we call as spicules. Okay, spicules of bones consist of bone matrix. Bone matrix has a dense network of collagen type 1. And then in the spicules, in the spicules, there are many osteoblasts attached. in the surface of the spicules, and inside the bone matrix there are many osteocytes like this one here. Okay, many osteocytes. This is many osteoblasts. You can see here this osteoblast has a quite large cytoplasm, so particularly this osteoblast might be originated from the young animals. So how about osteoclast? Osteoclast is a kind of macrophage derivative cells in the bone. Therefore, this osteoclast has the main functions to make phagocytosis, okay, of the bones. This osteoclast has a quite specific morphology. It has a multinucleated morphology. It has many nuclei. And then the main functions, because it has a macrophage properties, the main function is to engulf or to phagocytize bone fragments. Okay, therefore these cells are really important for bone resorptions. Okay, next, if you read in some literatures, osteoclasts do not have any receptor for PTH or parathyroid hormones. However, in the recent literatures showed that osteoclast also has a parathyroid hormone receptors on its surface. Okay, this is the histology of bone. In here we will more pay attentions on the shape of osteoclast. You can see here this is osteoclast, abundant cytoplasms with also many nuclei here. 1, 2, 3, 4, 5, 1, 2, 3, 4. It means this is a multinucleated nuclei. So if osteoblast makes bone formations, makes mineralizations, these osteoclasts, they take bone fragments. So this osteoclast main functions is for balance on bone formations. So if osteoblasts make more bones, the osteoclast will try to make it balance. They will, if the bone formations is too many, they will the osteoclast will be activated and then take some of the bone fragments to reshape the bone structures. Okay. Then the hormones that regulates also function of osteoclast is calcitonin. If PTH activate the osteoclast, calcitonin will inhibit the functions of osteoclast. As you know, PTH or parathyroid hormones is very important for calcium take up from the bones. Okay. In contrast with PTH, the calcitonin, its main function is to make calcium depositions into the bones. Okay, so deposit of calcium transportations into the bone is mediated by calcitonins. Okay, and then the calcifications, the mineral depositions in the bones, it's also facilitates by some substance that compose of lipid. For examples, in female estrogens, it's also kinds of a steroid hormones. You know that steroid actually compose from fats. These steroid hormones like estrogens facilitate the depositions of minerals, in particular calcium and phosphorus, into the bone. So in conclusions, okay, for these introductions, actually bones is a tissue, and the tissue of the bones will compose a full organs. Okay, morphologically that bone has a cortex. Okay, the outer part is cortex, and then it has a cavities. We call it the medullary cavity, the medulla, and then there is a pores, okay, or some spaces in the bones that we call the cancellous bone. And then at the bones, it also uh, can be divided into some regions. First is epiphysis, metaphysis, and diaphysis. I will explain to you later. Okay, here, this is a complete bone. This is a long bone here. This is the auricular cartilage. This is the cartilage that close with the joints. And just under the cartilage, there are spongy bone here. Okay, and the space of the spongy bone will be more wider here in the long part of the bone. Okay, and then this part here, we call it epiphysis, just under the auricular cartilage here. We call it epiphysis. And then from this part to this part, this is a more wider cancellous bone here. We call this part is metaphysis. And in the middle of metaphysis, we will find a growth plate. So in this growth plate, attach some of the cells that are responsible for the formations of bone. So osteoblasts, okay, and other stem cells are located just in this growth plate. Okay. And then these long bones, it called the regions of diaphysis. Okay. And then here to here is metaphysis, and this part is epiphysis here. Okay. And then if we cut the bone transversals, if we make transversal cutting on the bones, we will see a lot of canals. Okay, this canal means has some tunnels here, small one. We call this Haversian canals, and it has also some blood vessels. And then the bone also surrounded by a quite thick layers of fibrous tissue that we call as periosteum. Okay, and in this bone canal, there are many attached osteoclasts and also osteoblasts. Okay, this is the more close transverse view of a bones here. This is the Haversian canals here. There are layers, we call it the concentric lamella, and then this is the circumferential lamella. Okay, and then during the lesions of the bones will have sort of response. The bone response can be done in many conditions. First, it can be done as atrophy or hypertrophy, hyperplasia, metaplasia, and others. You know, atrophy is reductions in the size of organs. Hypertrophy is increased size of organs, and hyperplasia means increase formations of new cells. Okay, more additional cells. And then metaplasia is changes on the type of the cells. Neoplasia means tumor, and then you know degeneration and necrosis. Okay. So this is the most common findings and common process that represents the bone response to lesions, to injury. First is a healing after bone fractures. So as you know, bone fractures, it has, there are many types of bone fractures, right? However, morphologically, bone fractures categorize into two main findings. First is a simple fractures and comminuted fractures. Simple fractures means it's only break into two pieces. Okay. However, comminuted means the fractures makes the bone shattered into small pieces. So for comminuted fractures, the healing will be slower than the simple one. So there are also some examples of bone growth disturbance. First is dystrophy. Dystrophy means a growth disturbance of bones due to nutritional imbalance. So there are misshape of the bones. Or there is also amelia. Amelia means absence of extremities. There are no extremities at all. There are no hands or legs. Okay. For example, amelia can be happen due to, for example, the thalidomide intoxications. Okay. So thalidomide intoxications cause no formations of limbs. Okay. And then there is also hemimelia. Hemimelia means a congenital short bone. For this hemimelia, the long bones is just absent. Okay. However, the upper part of bone, it means the metaphysis still appear. Okay. However, the long part of or diaphysis is absent. And then there are also other type of bone growth disturbance which is more severe. It is phocomelia. Phocomelia means hypoplasia in the extremities. It means that the upper part of the bones also absent. There are misshape or misformation of the upper part of the bones. Okay, so the bones is small, short, and then the upper part, it means the epiphysis and metaphysis not formed perfectly. And then syndactyly means a extra fingers. Okay, this is a genetic uh, change that, or even if this is hereditary change that usually found in humans. There are also kyphosis, lordosis. You know kyphosis. Kyphosis is a round back. It means a hunchback. Okay. So this kyphosis usually caused by some lesions or disturbance in the growth at the vertebrae. And the most important lesions that can be found in bone is rickets and osteomalacia. So what is rickets? What is osteomalacia? Actually, it's just the same that rickets and osteomalacia means a immature skeleton. So this kind of immature skeleton caused by failure of mineralizations. It makes the bone more soft, easy to break, and then it may also cause deformity and leads to fractures. Okay, it's a rickets and osteomalacia is a kind also of bone growth disturbance. Okay, rickets occurs in animals, young animals. It means animals before puberty. After puberty, we call it osteomalacia. The cause of rickets and osteomalacia is a vitamin D deficiency. It can be also caused by chronic renal disease. Why? Because chronic renal disease cause deficiency of substance we call as provitamin D. As you know that vitamin D will facilitate the absorptions of calcium from the alimentary tract. No vitamin D, no provitamin D, no vitamin D, absorption of calcium will be low, okay, and it makes no mineralization in the bone. Therefore, uh, osteomalacia or rickets may occur. So in rickets and osteomalacia, this is the main characteristic. You will find what we call as facial chondrocytes thickening. It means that the metaphysis will be thick. Metaphysis will be thick and composed mainly by cartilage. And then because it has in rickets and osteomalacia, there is failure of bone mineralizations. It will cause a bone softening of the bones, and it makes failure on reproductions. So copulations cannot occur. It also causes bone pain and deformity of the bone shape. Okay, here we will see about rickets. Okay, notice here these are three kinds of bones in here. Okay, right? You can see here. So you can first see this is the growth plate, this is the growth plate, this is also growth plate. Okay, this is also growth plate here. You can see in here. The growth plate also is so thick here. It's so thick. And then as you see that the other bones are quite thick on this layer here, but these bones are thin. Okay, and also it has a thick metaphysis in here. Okay, why? Because in this thick metaphysis they are proliferate, but however they are failure of mineralizations, okay, in the heart bone in here. Okay, histologically we will find a thick cartilage here, but with minimum formation of mineralized matrix. Okay, minimum formation of mineralized matrix. Okay, it makes the bone also softer and easy to break off. Okay, this is perfect, I think, illustrations on normal bone and rickets. So this part is here actually a growth plate. In the growth plate there are some prodromal cells. These cells will uh, proliferate first, and then they will enlarge or hypertrophy, and then if it's normal it will have mineralizations. Okay, it will proliferate and then synthesizing minerals. It's osteoblast here, and also it will also help the formations of the blood vessels, because as you know that the mesenchymal stem cells, okay, also not only they form the osteoblast, but they also form blood vessels. Okay, and then this osteoblast will proliferate, okay, and then synthesize bone matrix. Okay, and then there will be complete mineralizations. However, in the rickets, it has the similar prodromal cells. It has similar progenitor cells here. However, the cells are hyperplastic and then enlarge here. Okay, hyperplastic, proliferate, enlarge. However, they cannot make a complete bone structures. Why? Because to make these complete bone structures, they have to make an osteoid or bone matrix first. And as you know, bone matrix needs calcium and phosphor. And calcium and phosphor is determined by the functions of vitamin D. No vitamin D, no calcium, no phosphor, it makes the mineralizations cannot be formed well. Okay, therefore there will be irregularity in the formations of bone matrix. Okay, and then in such cases, usually the hypoplastic conditions will be quite active. However, the formations of the enlarged osteoblast also occurs. However, no complete mineralizations occurs. That is rickets. Okay, that is also osteomalacia. So this is the brief pathogenesis on a osteomalacia and rickets. It means that there is interruption of the ossifications in the facial bones. Okay, and then there is a calcium and phosphor depositions which failed, and it makes no or less formations of osteoid tissue. And then the osteoid tissue will be composed mainly from cartilage. What we will see is widened and irregular epiphyseal lines, and also swelling of the bone extremities. So it means that metaphyseal part will be thick. Okay. Next is another lesions. If osteomalacia or rickets, okay, happens due to deficiency of vitamin D or no calcium, and also there is failure of formations of complete bone matrix. Okay. However, there is also other lesion. We call it the osteoporosis. In short terms, osteoporosis means spongy bones. What does it mean? In healthy bones, the bone matrix will be like this. It will be compact. Okay. However, will be compact and thick. However, in osteoporosis, bone matrix form well. However, the bone matrix is thin. Why it happens? It's not happens because vitamin D deficiency. No, it happens because the calcium cannot be bring in sufficient amount into this bone tissue. Therefore, the bone matrix, the formations is complete but thin. Okay, but have a thin structures. Therefore, it produce more sponges, more less density bone. So this osteoporosis can be caused by hypoplasia. Okay, so hypoplasia of the uh, osteoblast in here. So therefore, the formation of bone is not so active. Okay, and then this hypoplastic osteoporosis, I think happens quite frequent. Okay, it's actually in this osteoporosis. Maybe there is no deficiency of vitamin D, but however, the calcium cannot be taken up completely into the bone tissue. Okay. And then this osteosclerosis, this is really different condition compared with osteoporosis. In osteosclerosis, the bone tissue just so much. It means there is excessive formations of bone tissue. So the bone tissue will be so thick, the density is very thick. Why? In osteoporosis, the bone density is low, but in osteosclerosis, the bone density is high. Why? Because there is no osteoclast. Osteoclast cannot function well. It makes the resorptions not happen, and it makes the osteoblast synthesize more bone, synthesize more osteoids. Okay, this is the schematic diagrams of the pathogenesis of glucocorticoid causing an increased bone resorptions. Okay, so this is one of the main pathogenesis of a osteoporosis. Okay, because in the osteoporosis caused by excess glucocorticoid, usually first the bones already form completely. However, after that, the bone matrix, the calcium from the bone matrix will be taken step by step by the osteoclast. Why? Because the glucocorticoid will activate parathyroid hormones. It makes decreased calcium absorptions in the intestines. It will activate the parathyroid hormones to take up more calcium. And to take up more calcium, the PTH hormone will activate the osteoclast to engulf or to phagocytize more bone fragments. Therefore, increased osteoclast functions will cause increased bone resorptions and also low functions on osteoblasts and also osteocytes. Okay, so this excess glucocorticoid can be happen in a chronic stress, or it also can be happen in the animals which are treated with cortisol or some corticosteroids drugs. Okay, for examples like methylprednisone, prednisone, dexamethasone, and others. Okay, so it means that, for examples, in cases of dogs treated with long-term uh, corticosteroid, maybe the dogs will suffer from osteoporosis. Okay, osteoporosis means there is reductions of bone tissue and forming a larger pores of the bones. So in short term, there is decreased bone density. So calcium deficiency that happens after puberty or a starvation, glucocorticoid, it causes a osteoporosis. The bone density will be decreased. Inactive or sedentary life also cause osteoporosis. Why? Because a sedentary life or inactive life will make the contractions of muscles reduce, and as you know that the contraction of muscles will also facilitate the movements of the blood vessels, the contractions of the blood vessels, which help to transport nutrients into the bone and surrounding tissue. Less muscle contractions in the around the bone will make less uh, less contractions on blood vessels. It makes less nutritions transported into the bone. And then the other cause of osteoporosis is the uh, low concentrations of steroid hormones like estrogens. In older animals or animals with ovariectomy, they will experience on estrogens deficiency. This estrogen deficiency will make the depositions of calcium into the bone will be reduced. Okay, at first the bone normally form. However, after that it will take the deficiency of estrogens will make less calcium deposition, that makes more calcium will be taken up from the bones by the parathyroid hormones. Okay. Yeah, sorry, it's still in Bahasa. So in this case, the bone is very soft, and then it's easy to bend, and even it's easy to be break off. It's easy for break off. It means it's easy for fractures. Okay, this is the normal bone here. Okay, this is normal bones with a complete or intact bone density here. However, in the osteoporosis, the bone matrix will take up less color, less stainings, and also it has some spaces, okay, within the matrix here. So it affects the bone density. The cause can be starvations, inactive muscles, just like I said, senile osteoporosis related with hormone deficiency, steroid hormone deficiency, and also some intestinal parasites that absorb more calcium. Okay, this parasite take the calcium from the host, or deficiency of calcium and phosphor can cause also uh, osteoporosis. Okay, so usually osteoporosis occurs in older animals, but sometimes in some particular case, osteoporosis can be happen also in uh, fetus, even in fetus. Okay, the fetus with this hypoplastic osteoporosis here, okay, they will have a very thin uh, they will have a thin metaphysis here, okay, and also less formations of a bone spicules or bone matrix, okay, because there is no uh, proliferations or hypertrophy of the bone cells here, or there is less activations of the bone progenitor cells. It makes the formations of the bone is not complete. So in particular, the bone will be shorter than normal. Okay. This is what we call as chondrodystrophia fetalis here. There is also what we call as fibrous osteodystrophy. So fibrous osteodystrophy, it means that there is increased resorptions of bones which is replaced by fibrous tissue. So in this fibrous osteodystrophy, there should be a hyperparathyroidism first. This hyperparathyroidism caused by hyperplasia due to some drugs. Okay, there are some drugs causing hyperparathyroidism, or tumors, adenoma of parathyroids, or carcinoma of parathyroid will cause more active bone resorptions, and then this parathyroid hormone also will facilitate and makes proliferations of collagen tissue. The symptoms is just the same with osteoporosis or osteomalacia. Okay, the most frequent cause of osteodystrophy fibrosa is a chronic renal failures. Chronic renal failures will make less pro-vitamin D productions, and it will also will also affect the absorptions of calcium from the intestines. Less calcium absorptions will activate more calcium take up by parathyroid hormones from the bone. This activated parathyroid hormone will also stimulate the formations of fibrous tissue, and this fibrous tissue will fill the spaces in the bone. Okay. Yeah, this is the histopathology here. This is the bone spicules. You can see here there are less and maybe no osteoblasts at all, but there are many osteoclasts like this. And then this is the bone marrow actually, but the bone marrow filled with fibroblastic tissue. Usually this fibrosis or fibroblastic tissue will make a irregular surface, and it will make a asymmetric swelling in some part of the bones, in particular thin bones. For example, bone in the face. For example, this is bone just under the eye or the maxilla. Bones here in the upper jaw here, in the maxilla here, filled with fibrous tissue. It makes the part here swollen, and then it has a irregular surface due to formations of fibrous materials. So if we cut the bones with fibrous osteodystrophia, we will find a formation of fibrous tissue like this. And it also, the bone will have a rough structures. However, please do not mistaken the rough structures with the hypervitaminosis A, because hypervitaminosis A also can make rough structures due to excessive formations of bone here, excessive formations of cells within the bones. Okay, really different, because if we cut fibrous osteodystrophia, will have more fibrous tissue. For hypervitamin vitamin A, only in the surface. Bone inflammations. If the inflammation occurs in the layers that encapsulated the bone, we call it the periostitis, because it happens in the periosteums. And then if the inflammation spread into the medullary cavity, we call it osteomyelitis. Okay, so it means osteomyelitis means bone inflammations into the medullary cavity. For examples, due to actinomyces pyogenes. So osteomyelitis caused by actinomyces, it causes the pyogranulomatous inflammations. This is, actinomyces is a kind of bacteria. The disease found in cattle. It causes a lower jaw irregularity because there are distractions of lower jaw by the formations of pus exudates. Okay, and then because it's so severe, even the bone fragments are quite large, and it looks like there is macerations in the bone in the affected area. Okay, this is examples of osteomyelitis here. So the inflammations reach the medullary part of the bones. Okay, sometimes it also can happen in the vertebrae. It has maybe only small holes, but these small holes become the port of entry of the bacteria, and this bacteria invade until the medullary part of the bone, and then causing a abscess. This abscess will cause lysis of the surrounding tissue and makes swelling. Okay, why? Because as you know, abscess or suppurative exudates, it has a lot of proteolytic enzyme activity. It will lyse surrounding tissue, and then it will make a swelling. Okay, this swelling also can cause some significant and constant pressures in the surrounding tissue, just like this one here. Okay, this is the cases of a bone osteomyelitis due to coccidioides immitis. Okay, this one here is a, you can see here, this is bright field here. Okay, why? Because there is formations of maybe a lot of pus, including also some fibrous tissue here. Okay, sometimes it can be also mistaken as the tumor, bone tumors. Okay, this is the histopathology of osteomyelitis. Destructions occur in the cartilage that spread into the medullary of the bones. Okay, just like this one also. If it's already reached medullary of the bones, we call it osteomyelitis. Myelitis or myelohair originated from the words of medullary cavity. So next, how about joints? Okay, the pathology of joints is not so it has not so much difficulties, not so many lesions related with joints. However, the case is quite frequent. Okay, this is the anatomy of the joints here. So this is the cartilage of joints. We call it the pannus here, and then the normal joint will be like this. This is the pannus, the cartilage, and this is the articular part here, articular space, and this part of pannus covered with synovial membranes. However, in the arthritis, there are some destructions in the pannus, leaving spaces like here, like this one here. Okay. And then in healthy animals, the joints will be smooth, glistening. It has intact synovial membranes with uh, some clear articular fluid. If there is arthritis, if it's acute, the joint will be swelling, and then there is irregular and hazy surface. Also color change, in particular in the acute stage of arthritis. And then what you have to remember is during the arthritis, there is increased fluid and presence of exudates. It can be a serous exudates, purulent, or the combinations. Okay, this is these pictures here represents the difference between normal joint and normal joints with arthritis here. This is normal joints with complete cartilage, but this is cartilage already lost, already break off. Okay, they are incomplete cartilage here due to cartilage loss. Okay, and then usually the cartilage will be thin. Okay, these cases occurs, for example, in the case of rheumatoid arthritis in human. Next is one of the most common findings, in particular in German Shepherd. There is a case of arthritis, okay, chronic arthritis due to some degenerative disease in the joint, okay, that we call as hip dysplasia. So this is the normal bones here. This is the head of the femur. This is the hip socket or acetabulum. Okay, so in the case of hip dysplasia, the cap of the femur, the femoral head will be misshapen. Misshapen is deformed, so it cannot fill well the acetabulum. In some cases, in hip dysplasia, there is also shallow hip socket. It means that the socket, okay, the socket is quite thin, and it makes the uh, femoral head cannot be fully inserted into the hip socket or acetabulums. It will cause a constant irritation that may lead to arthritis. Okay, for example, this is normal hip. This is the hip socket or acetabulums. You can see here that the femoral cap fully match with the acetabulum. But however, in dysplasia, in here and in here, you can see here there is spaces between the femoral head with the acetabulums. These spaces makes a constant irritations, okay, constant irritation which cause arthritis. In some severe cases, usually the animals will be paralyzed, okay, and then the muscles in the limb is usually the muscle will be thin because inactive. Okay, they cannot use it for a normal walk, and therefore in such cases usually uh, they will have uh, they will have some difficulties on walking. Okay, this is the common areas with bone abnormalities in dogs, but the most common site is in here in hip. Okay, so this is the microscopic appearance of arthritis or joint inflammation here. Okay, you can see here there is a cartilage loss with also formations of maybe I think hemorrhage here, and then the articular joints were filled with some pus or suppurative exudates. The causes are numerous. It can be Actinobacillus, erysipelotrix, E. coli, or even Mycoplasma bovis. My experience is when I was studying in Japan, there are many cases of this one here. This is one of the main cause of arthritis in swine or in pigs. And please be careful if you find arthritis in the extremities in swine, for example, and also the swine has sort of a lesions, a diamond-shaped lesions in the skin. You have to be careful because it will be related with this erysipelosis. And as you know, erysipelosis is a zoonotic disease. All right. Okay, actinobacillus. Maybe I think this one is actinomycosis. Sorry, I'm a bit mistakes here. Actually, this is not actinobacillosis, but this is a case of actinomycosis here. Okay, actinomycosis causing lumpy jaw or macerations and destructions of the mandibles here and here. Okay. Now, the other disease in joint is gout. Gout is a elevated conditions of uric acid, uh, elevated concentration of uric acid in the tissue and also in the blood, and this uric acid can be accumulated in the joints, which makes the joints will be more painful because there is inflammations due to the depositions of the uric acid. Why? Because uric acid form crystals. Crystals of this uric acid has a sharp edge like this, that causing a very painful symptoms to the animals. Okay, and then if there is uric acid formations, abundant uric acid formations, it will also affect the kidney because a lot of uric acid will be accumulated in kidney, and this crystal of uric acid will cause tubular distraction in kidney. So chronic gout also will lead to renal failure. So articular gout, this is the most common findings. We can find this articular gout in all mammals, including humans, and also in, I think, in avian and also reptiles. What we can find is there is a swollen joint here, there is malformations of joints, and then there is a whitish paste. So this uric acid will form sort of whitish paste materials that accumulated uh, in the articular or in the joints. Okay. And then some this articular gout also can be caused by high protein diet. So the proteins will usually has a lot of purines. Okay, these purines will be transformed into uric acid, in particular in the liver. More protein diets, more uric acid. Okay, this is case in chicken that the uric acid accumulated in the legs, in particular just in the joints. Okay, this one here in the legs of chickens, just between the joints of the fingers. Okay, this is also cases of uric acid deposition in the hock joints of chickens. This is in the leg here. Okay, this is the normal chickens. This is with gout, articular gout. And if we look, the histopathology of gout is this is the crystals. This crystals is very hard and it's also sharp, very sharp. It makes destructions in the tissue because these crystals are difficult to engulf or difficult to phagocytize. Therefore, the body will form a many giant cells and also a lot of macrophages to fully engulf or fully phagocytosis of these materials. However, it takes long time for phagocytosis. Therefore, in the gout cases, in chronic gout cases, there will be also formations of uh, fibrous tissue surrounding the lesions. Actually, it causes what we call as granulomatous lesions here. This is the crystals and many macrophages and also many giant cells, multinucleated giant cells, and surround with uh, fibrous tissue. This is a typical case of granuloma. Then in avian species, chicken, birds, and also reptiles, the uric acid accumulations can be happen also in the visceral organs. It can be happen kidney inside and also outside the kidney, in the serosal part of kidney, serosal part of liver, peritoneum, air sacs. It forms a that whitish paste or chalky materials attached with the tissue. Okay. So failure of uric acid secretions. Usually this failure will happen if the uric acid is so abundant and this uric acid already make a chronic nephritis, chronic kidney inflammations. If there is renal failures, it will be more difficult to release the uric acid. It makes the uric acid accumulate inside the kidney and also inside the ureters. Okay. In some cases, the ureters not fully blocked. Okay. However, the kidney already quite the damage is quite severe. However, if the kidney already reach their end stage kidney, okay, it makes the kidney will release more waters. Releasing more waters will lead to what we call as dehydrations. Okay, here you can see here, this is the uric acid release from the tubular cells here. It will be released the uric acid from the tubular cells into the urine. Okay, if the tubular cells are damaged, okay, this are if the tubular cells are disrupted by the uric acid, this normal process will not be happen. Therefore, the uric acid can be accumulated in the kidney and also inside the tubulus. Okay, this is the examples of visceral gout in the kidney of chicken. Okay, this is the formations of uric acid in the ureters. Okay, this is also uric acid in the ureters here, but if the uric acid accumulations are more pronounced, much more happens, it will lead to this kidney atrophy. Why? Because the kidney will be more there will be more destructions in kidney due to this uric acid. Therefore, the kidney shape will be reduced. Okay, this is cases of visceral gout in the birds here. You can see here the serosal part of liver and serosal part of heart. Okay, the pericardial sac has a chalky whitish materials attached with this part here. It's really different compared with fibrin. So because it is more rough and it has a chalky like it's a chalky like materials, okay, not forming a false membrane just like the fibrinous exudates. Okay, this is the histopathology again here. This is the uric acid crystals and this is the macrophages and giant cells. So we can apply a special stain, we call it the methenamine silver stain, to differentiate this or to detect this uric acid crystals. Okay. All right, I think that's the end of my lectures on bone and joint pathology. Now I would like to give you some explanations on the slides that you will get for practice in the Thursday. So first slide is about hepatitis contagiosa canis. So hepatitis contagiosa canis means a canine infectious hepatitis. It caused by adenovirus. What you will find that you can see here is you can find in this slide is first is there will be congestions. In the congestions, the sinusoid will be wider and filled with erythrocytes, and then there are also some inflammatory cells in the sinusoids, in particular lymphocytes and macrophages, and then the hepatocytes has a very small a very small vacuoles, okay, which indicate the hydropic degenerations. And then the main lesion is formations of inclusion bodies, adenoviral inclusion bodies, okay, inside the nuclei or internuclear inclusion bodies. Okay, it has a red colors, the inclusion bodies, and then because this is a chronic inflammation occurs, and there is also some disturbance in the functions of liver, there will be intracellular bile pigment within the hepatocytes. This bile pigment it will show as a brownish colors pigment inside the cytoplasms of hepatocytes. Okay. And then some of the lobulus will also surrounded by perilobular fibrosis. Next is cholangiohepatitis due to fasciola infections. These fasciola species, these kinds of trematodes, they will make constant irritations in the surrounding tissue. Usually we will find this fasciola inside the bile duct. Irritations, chronic irritation from the fasciola in the bile duct will cause a chronic inflammations. The chronic inflammations will be characterized as a chronic cells, chronic inflammatory cells, infiltrations, like there you can find macrophages, and then you can find lymphocytes or plasma cells, and then this trematodes, this fasciola will also a the fasciola will also stimulates the bile duct tissue to proliferate. Okay, and then the bile duct tissue will also produce more mucus, so you will find many goblet cells uh, in the bile ducts, in the thickening bile ducts, and then there you can see also large, or sorry, thick layers of fibrous tissue. Okay, and then of course you will also find you must also find this large fasciola trematodes inside the bile duct. Okay, I think I will continue with the last slide here. Okay, the last slide is slides from the enteritis. Enteritis caused by coccidia infections. Enteritis means inflammations of the intestines. So if it's inflammation of intestines, what you can find is there are also many inflammatory cells just under the epithelia. It means in the lamina propria you will find many inflammatory cells. You will find cells like this, lymphocytes, okay, and then plasma cells. Maybe you can also find uh, eosinophils. Eosinophils means a uh, polymorphonuclear cells, but with uh, reddish, sorry, with reddish granules in the cytoplasma, or also you can find a large cells, we call it macrophages. Okay, and then due to this enteritis, there will be also desquamated epithelia. Okay, and then also the crypts will be filled with some mucus, and then you will find many goblet cells, okay, in the crypts of the intestines. And then in the most interesting and the most significant findings, okay, the characteristic findings here is you can find the stages, various stages of coccidia inside the cells of the crypts. Okay, inside the cells of the crypts, many coccidia. It has a red color, round shape, and red color structures. Okay, I think that's all for my lectures. If you have any questions, please feel free to ask me. Thank you for your attention.